we have our sutures. We have our coronal suture, sagittal suture, and lambdoid suture. You have your frontal bone, parietal bones, and occipital bone in the skull cap. If we look at here, we have our, this is our, I'm trying to think here, sorry. This is all part of the frontal bone. And the ethmoid bone is this center part here. So the crista galli is here, the cribriform plate is here, and then the foramina will be found on the plate, so that'll be cribriform foramina or olfactory foramina, whichever one you want. We move down to our sphenoid bone, where we have our lesser wings and our greater wings. So you want to think of this like different floors, right?
So first floor, second floor.
First floor, second floor, third floor, and then you have your anterior cranial fossa, middle cranial fossa, and posterior cranial fossa.
And that's just the entire.
Yeah, that's just like the whole floor, basically, right? Okay, so on that first floor, on the sphenoid bone, you're going to have your optic canal, okay? In between the optic canals, if you were to connect both, you have your optic groove. I think you guys cross it off. It's fine, don't worry about it. This is tuberculum sellae. This is hypophyseal fossa, tuberculum sellae, posterior clinoid processes, and anterior clinoid processes. And the thing about this is that this whole structure here is a sella turcica. The sella turcica does not include the anterior clinoid processes.
Okay.
Okay. You have, if we start here at the very top, the hole that's here, this is foramen rotundum, foramen ovale, and foramen spinosum. Most medial, you're going to find the foramen lacerum on either end. Once you find the foramen lacerum, if you were to take your stick and put it at an angle, you're in the carotid canal. Okay? So foramen lacerum, carotid canal. Okay? And then this is we move on to I can't forget, this is the superior orbital fissure. That's in between the floor, right? Top floor, middle floor, and right underneath that lesser wing is the superior orbital fissure. And then we move on to the temporal bone. This is going to be the petrous part of the temporal bone. Petrous part of the temporal bone. Yeah, it's the little mountain. Petrous, like piedras. Right? So petrous part of the temporal bone. And on the petrous part, on the posterior part, you're going to have the internal acoustic meatus, or internal auditory canal, however you want to call it. Just below that, you have the jelly bean looking like hole that is your jugular foramen on both sides. And then you're going to find so we're going to move on to the outside. So this is still the temporal bone. We're still on the temporal bone. You're going to have yeah, it's a little confusing. So you have, it's not very obvious here, but you see that little number? Let's just pretend there's a line here. On the exam, she's going to pick a skull that has a very clear, distinct suture or line that's been painted, but you'll be able to see it, so pay attention. So let's say the line's here, okay, for the sake of this video. So before this line, you have so this is your zygomatic bone, okay? And in order to get to the zygomatic bone, we need a bridge, right? So on the temporal bone, there's going to be a zygomatic bridge. That's the way I remember it, okay? So we have the zygomatic process of the temporal bone. And if we're at the zygomatic bone trying to get to the temporal bone, we're going to need a temporal bridge. So we have the temporal process of the zygomatic bone.
Temporal process. So temporal to get to zygomatic, zygomatic to get to temporal.
Exactly. Okay, so you have the zygomatic process of the temporal bone and the temporal process of the zygomatic bone. And then this whole thing is called the zygomatic arch.
Zygomatic arch.
Yes. And then here you have your mastoid process, your styloid process, and in between both of them, you have your stylomastoid foramen. And then you have what looks like you'd be picking your ear. You have your external acoustic meatus. If we were to revisit the sphenoid bone, I did not mention the. Sorry, I didn't mention the pterygoid processes. These are the pterygoid processes. And then you have your lateral plates and your medial plates of the pterygoid process. So medial plate of pterygoid process, lateral plate of pterygoid process. And here you can also see that you can, first of all, this down here is your carotid canal. This would be foramen spinosum. This would be foramen ovale. And this would be foramen lacerum. You have to make sure that you know them, that you know them from the inferior view as well. Then we move on to our occipital bone. We have our occipital condyles. You have foramen magnum. You have the external occipital crest. You have the external occipital protuberance. If we follow the external occipital protuberance, we'll see the superior nuchal lines. And then just below it, like a little happy face on each side, you have your inferior nuchal lines. Okay? On the inside, we still have a crest. Now it's internal occipital crest and the internal occipital protuberance. So if there's a sticker here, she wants the protuberance, okay? If she wants the crest, she'll have an arrow like pointing up and pointing down for the crest, right? Because it's this whole thing, okay? What else am I missing? Oh, okay, let's move on to the front. I think that's everything on the inside. I'm trying to remember, make sure, okay? If I remember anything, I'll go back. Remember, if there's a hole here, it's the frontal sinus. She will not ask you on a skull like this and point here and say what would be here if there. She won't do that. It's either a hole or it's not there. Okay, so this is a squamous part. Oh, that's what I forgot. This is a squamous part of the temporal bone. So squamous, remember, means flat-like. So this is the squamous part of the temporal bone. This is the squamous part of the frontal bone. These are our superciliary arches. This is the glabella. These little tiny notches here are going to be the supraorbital notch, or foramen if it's a hole. Okay, before we had our superior orbital fissure, right? And then we have our inferior orbital fissure. We have our nasolacrimal canal. If I put my fingers inside the skull and kind of pretend like I'm going to tear it apart, like pull it apart each way, where my finger pads are for my index fingers, that is the lacrimal fossa, and that's where the lacrimal gland sits, right? So this here is your lacrimal bone. So the reason I point that out is because the lacrimal fossa is not on the lacrimal bone. The lacrimal bone is down here. Okay. So here's a lacrimal bone. If we get into the ethmoid bone, if we get into the orbit, we want to remember that the ethmoid bone, if you were to reach back, right, in between the eyes, that you're on the ethmoid bone, on the orbital surface of the ethmoid bone. Okay, and then here you're on the orbital surface of the maxilla. So here we have the maxilla. This is the frontal process. So the frontal process of the maxilla is between the nasal bone and the lacrimal bone, right? Because they're here and the frontal process is here. Remember, a process, especially if it has a frontal process, it's letting you know it's heading towards the frontal bone. Like frontal process, zygomatic process heading towards the zygomatic bone. Temporal process heading towards the temporal bone. So the frontal process is heading towards the frontal bone. This is the nasolacrimal suture. I'm sorry, nasolacrimal suture. Frontal nasal suture, sorry. So anytime we're referring to the orbit, here we have our supraorbital notch. Now we have our infraorbital foramen. On the maxilla, you have your alveolar process, which I guess you think of as your gums. This is the vomer bone. This is a perpendicular plate of the ethmoid bone. You have your inferior nasal concha and your middle nasal concha. And can we see our superior nasal concha? No. So she will not ask you a question like that unless it's on a drawing, like in your book, that you can see. All right, awesome. This is also vomer bone back here. Okay. While we're at it down here, this is, since we are on maxilla, this is so remember, this is our palatine bone, horizontal plate of the palatine bone. So this is our palatine bone, so this is going to be our palatine process of the maxilla. Okay, the hard palate, right? The first part of the hard palate is called your palatine process of the maxilla. okay? And then you have your greater palatine foramina. If you only have one hole, because you have a greater and lesser palatine foramina, if you only have one hole, it's absolutely the greater.
The greater.
Because you're not going to see lesser unless you can see greater,
Okay.
right? And then you have, what else? Here, yes. Oh, you have your mandibular fossa, right? Mandibular fossa because the mandible is going to articulate there. And what else? Am I missing something? This is your zygomatic bone. We already went over that. I feel like I'm missing something and I don't know what it is. Okay, let's go over the mandible. Where's your mandible? Okay. So mandible, here's your body. Alveolar process of the mandible. This is your mental protuberance, mental foramen. You have your coronoid process, your mandibular condyle, the mandibular notch, mandibular foramen, and you have your ramus, which is the bar, right? This whole thing is the bar. This is the ramus, and then this is the angle. And I think that's it.
Just what it's called, the angle?
Mandibular angle. That's it.
Okay, mandibular.
Mandibular angle or angle of mandible, whatever, whichever one you wanna. I think that's it. Oh, I lied. This is your incisive canal. Incisive canal. Because these are your incisors. It's named after your incisors. Incisive canal. I can't think of anything else that I missed.